Hi everyone, Elizabeth here. Today we are doing a neurotoxin treatment. We are starting up on the frontalis. This patient has been getting consistent treatment for almost 2 years now, and her skin has the prettiest glow. It is so smooth. She also uses medical grade skincare and sees our esthetician as well. But just the overall texture of her skin has improved over the past few years. And of course, she's young, in general, but starting now and preventing is what's going to maintain this beautiful skin texture for her. So we are starting off with her frontalis. I'm just treating from one lateral border to the other. She has a really beautiful arch in her brow, so I'm just making sure that I'm only treating up high and keeping those lower fibers active, just to make sure we're not giving her any sort of ptosis in her brow. Now we're moving on to her glabella. Again, she's been treated pretty consistently, so she is seeing some muscle atrophy here. I did decrease her dose a little bit today, and we will see how that lasts for her. But for her, we are treating the procerus as well as the medial corrugators. Here I am just using my thumb to almost pinch off that orbital rim. Just some gentle pressure. It's most important that you're treating in that correct plane and correct depth versus, having your finger there. It's more of just a mind reminder to ensure that we're treating in the correct location. But for her, I only treat her medial corrugators because now we can't really see where that tail is pulling. Now we're going down and treating her mentalis. We're doing this for a little bit of lengthening and just texture. That orange peel texture you could see when she pulled up with her lower lip. You can see that texture there. And we're treating her DAO as well. She has pretty strong lower face muscles, and you'll see here in a second when we treat her platysmas. But we just do, a little bit. Again, we're preventing for her. We did a small enhancement on her left side for her TMJ. This is the side that she chews on. We had treated this 2 weeks ago because she was starting to have pain. So we just did, a small enhancement there, and hopefully that does the trick. And now we're moving on and treating her platysmas. Like I said, she does have pretty strong lower face muscles. And as you can see, it's a little bit hard for her to make that face, but I have my patient kind of pull down their lower lip and over exaggerate, and I pinch that muscle and just work my way all the way down. And as you can see, you can kind of pop back in. You just want to make sure that you always can feel that muscle in between your fingers. I'm never blindly injecting into the neck. So just make sure you can isolate as you're going ahead and injecting. And we are just finishing off with a little lip flip. She has beautiful lips. She has a little bit of filler in there as well. But she does like the look of having a lip flip. So we were just going ahead and treating her top lip. I'm treating very superficial, and I'm using a Comfortox 0.3 cc syringe here.